I'm Dr. Shefali Agrawal, Senior Consultant in Surgical Oncology at Indraprastha Apollo Hospitals, New Delhi. I specialize within surgical oncology in the surgical treatment of gastrointestinal, hepatobiliary and pancreatic cancers. I was trained at the Johns Hopkins University School of Medicine in Baltimore, USA, and was on the faculty in the US prior to returning to India a few years ago. The key thing with the treatment of gastrointestinal, liver and pancreatic cancers is that some of them carry a very poor prognosis, and often they are not amenable to surgical therapy when they are diagnosed. The only potentially curative treatment for pancreatic, liver as well as gastrointestinal cancers is a curative operation. Unfortunately, by the time the patient presents to us, particularly in pancreatic and liver cancers, the tumor is not, or the cancer is not amenable to complete surgical removal. So, early diagnosis is important in these cancers, as in all cancers, and ignoring of symptoms or delay in diagnosis for any reason, which can even be a physician-related delay in diagnosis, impacts the survival outcome in patients with gastrointestinal cancers. There are modalities by which early diagnosis can be facilitated. One of them is a colonoscopy starting at the age of 50 for patients to diagnose colon cancers, as well as patients who have liver disease such as cirrhosis. They are at increased risk for development of hepatocellular carcinoma, which is a liver cancer. They should be placed on surveillance with some blood tests and some imaging tests to periodically check for the development of liver tumors. And in case of pancreatic cancer, there is no approved method of surveillance, but any symptoms, abdominal symptoms which persist beyond a few weeks, even if they are non-specific and not obvious symptoms like jaundice, weight loss, abdominal pain, they should be thoroughly investigated by a specialist. And we heavily depend on imaging, which is CT scan, to further stage and work up these tumors. Based on the specialized CT scans, we determine if the tumor can be surgically removed or not. And if they cannot be surgically removed, then we will treat them with using chemotherapy with or without radiation therapy and make it amenable for surgical cases. The treatment of gastrointestinal, liver and pancreatic tumors is multimodality. It requires the use of both surgical therapy with radiation and chemotherapy. All three modalities are required to get the best survival outcomes. Another very important factor in the treatment of gastrointestinal, liver and pancreatic cancers is the quality of life. We don't want to perform very extensive operations all at the premise of improving survival, but ruin the quality of life. So the kind of therapy which is offered is a balance between both the quality of life as well as survival. Survival and oncologic outcomes remain our key determinant in outlining the therapy for the patient, and stage of the cancer at which it is diagnosed, what is paramount in the prognosis of the patient. Treatment of gastrointestinal, pancreatic cancers and liver cancers should be performed at specialized centers which offer these multimodality treatments, as well as the imaging diagnostic modalities to ensure optimal outcomes. And the treatment should be coordinated by specialized oncologists who have experience in the treatment of these complex and difficult to treat cancers.